My first question is, in your opinion, why do women get surgery? What do you see in your clinic on a daily basis? Like, why are women getting surgery? And what are you seeing in your clinic at the moment in 2023?
So when you say surgery, it's for reconstructive purposes, it's for treatments, okay? However, when you see aesthetic surgery, it's a way of body alteration. Motivation can be different, but the aim is body alteration. And the aim for body alteration is to look more attractive to the opposite sex. Now, when you look at throughout humanity and culture, body alteration is older than surgery. I'll give you two examples. If you look at some of the African cultures, in some of the African cultures, they have these neck bracelets that is put on through stages in life, where women start getting longer necks. Okay, so this is a body alteration in their culture. Some of the tribes, I think in South America, they wear extremely large earrings in their earlobes, and some tribes in like New Guinea, they wear like blocks of wood to have their lips larger. So these are all body alterations. These body alterations can be done to have more status in society, in their own culture, to look more attractive, to look more dominant. But basically, this is a body alteration. Aesthetic surgery is also body alteration with different motives, okay? So this is here to stay because it was here for hundreds or maybe thousands of years. And now we have the technology to do surgery, alter the body, and this will continue with different technologies. Especially women are interested in this because women have a desire to look good for the opposite sex. Most of them, they say, oh, we do it for ourselves. But it's basically the instinct is to look good for the opposite sex, to be admirable, to be accepted, and especially to be sexually desired and sexually accepted. Most of the women, when they have surgery, not only do they want to look beautiful, they actually want to look younger, because youth is associated with beauty, and youth is also associated with fertility. When men choose a woman in the society, in all cultures, they want to go for a younger woman, and the reason is to be able to get to healthier and younger eggs to breed with. So this is what's encoded in our minds.
Well, you know, we have agents here, you know, setting this all up for everyone. So it's really accessible, and you know, yes, there's also in the West here in England, there's a huge culture of feminism, and they're the people that are saying, oh, it doesn't, you know, matter what you look like, you're all perfect. But then
people go, okay, so it's almost like somebody can tell you something, but it's not going to change whatever you believe a whole lot. If you want to look good, no matter what people tell you, and if you look in the mirror and think that there is a problem, even if people say, oh, girl, you look good, you still want to change it. That's an intrinsic drive coming from inside to look good, okay? You cannot change that. Of course you want to look good. That's completely normal. There are ways to look good. You can lose weight, you can start sports, you can eating a healthy diet, or you can have cosmetic surgery to look good, okay? You can have makeup to look good. So just letting yourself go and being non-feminine, and even in masculinity, okay? You cannot just let yourself go and become, you know, obese. As a man, you have to be fit. You have to be. This is for your health and also for your self-confidence. So these are important things. So that drive from feminism saying, "Oh, you shouldn't get that. You shouldn't do that." I don't think that can last very long because it's not very realistic.
And the thing is even though they're saying, you know, oh, it shouldn't matter, and they've all got kind of blue hair and purple hair and, you know, a huge piercing, they still put makeup on.
You know, even putting a piercing is body alteration. I mean, if you look at it, just like somebody's putting a huge earring like thousands of years ago, or getting those rings on the neck, these are all body alterations. If these people who support that, oh, you shouldn't change your body, they should just wash their hair and wear a t-shirt and go out. It's fine. I mean, if you want to live like that, that's fine. I respect that. I don't care. But you cannot judge a person who wants to change their body and try to look good.
Mm-hmm. Yeah, absolutely. Absolutely, for sure. And just following on from that, do you think that men prefer women who have had aesthetic procedures or surgeries? And if so, what surgeries do they tend to prefer women to have? Like, you know, subconsciously.
Mm-hmm.
We've spoken about this before, but what are the attraction cues for a man when they see a woman, and how does surgery go into that?
So it's going to change for a lot of cultures, actually. Okay, and it's also going to change for a lot of like personal preference. Some people may like larger buttocks. Some people may prefer larger breasts, or some people may prefer smaller breasts. It will change. What is perceived as attractive in a female is someone who can bear a child in a healthy way. So like the Coca-Cola body shape, where the breasts are a little bit larger, not too large maybe, and the buttock that is a little bit larger is consistent with childbearing and fertility. Okay, so even though sometimes extremely thin models go out, and in the past probably like Tweegan or something, but in the man's mind, a larger frame, not too large, may be coded as more fertile. In order to give out that vibe and that message, people are getting buttock augmentation. People are trying to thin their waist, and people are trying to uplift their breasts so it looks younger, and also enlarge the breasts, just to achieve that female form that is accepted overall, and probably throughout cultures and geographies, and also throughout time. Because you're giving a vibe that you are healthy, you have enough fat in your body, okay, because fat is consistent with feeding, not too much fat, obviously, but it's also consistent with normal hormonal balance. Because extremely thin ladies, like they're working out all the time, they have menstrual problems, they might have hormonal problems, and they may not bear a child in a healthy way.
My final question is like about men having plastic surgery. Do you think that men are having plastic surgery due to the feminization of men at the moment? Is it a good or bad thing? You know, does it improve a man's value having surgeries or aesthetic procedures?
Yeah, so this is a very important question, and you addressed it in a very nice way. So men having cosmetic surgery is not due to feminization. Okay, it's more like women, just like men go for a good-looking woman, women also want to go for a good-looking man. Okay, but what men look for in women is completely different from what women look for in men. They want to see a more masculine figure, consistent with like a stronger jaw rather than a jaw that is back. Okay, maybe not too much prominent ears. Okay, more masculine nose, and maybe a little bit less fat on the face. Okay, so this is consistent with a more masculine look. In addition, if you look at the body, one of the things that men really complain is gynecomastia. The only thing is, like, men concentrating on what is known as looks max is not a very optimal thing, because they think that once they change their body, once they start looking better, they will get more attention from females. In a way, it's correct, but that's not the only thing. So I think it's not very good to concentrate only on one aspect of masculinity, which is to look good only. Okay, they have to concentrate on other aspects as well. And then what makes you man in terms of like status, in terms of, you know, being very socially active or having, you know, good income. These are also important things. But looking good and being attractive physically is the first step into the, you know, dating or in a relationship. It's very important. Now, when you look at men, they are increasingly getting cosmetic surgery as well, but not as much as the females, because I think overall the female standard in a man is a little bit lower than a male standard in a woman. Okay, so it's not a must, but they do get it.
Mm-hmm.